Hello, my name is Brennan. I'm going to be your nurse today. First, I need to do some hand hygiene real quick and put my gloves on. Do you mind while I'm doing this just telling me your name and your date of birth?
Shelby Shipley, 11/5/94.
Alright, Shelby, do you mind if I just check your wristband to confirm that? Good, and we have the right patient. Shelby, how are you doing today? Are you in any kind of pain or discomfort?
Okay, fine.
Feeling fine? Okay, good. Alright, so what I'm going to be doing is I'm going to do a head-to-toe assessment on you. So I'm going to go ahead and just shut this door right here and pull this curtain for your privacy. If at any point during the exam you feel uncomfortable or you have any questions about what I'm doing, just stop me and let me know. We'll go from there, okay? I'm going to check in all your body systems. First thing I need to do is just ask you a couple questions, okay? So, do you know where you are right now?
Erasement.
Okay, and do you know what year it is?
2020.
And do you know who the President of the United States is?
Donald Trump.
Okay, and can you tell me your name one more time?
Shelby.
Okay, good. Thank you, Shelby. The next thing I'm going to do is I'll be assessing her nutritional status, and she looks like she eats well and is well nourished. We'll go ahead and just ask her, are you able to get your meals? You feel like you are able to eat well? You never have to really skip a meal or anything? No? Okay, good. And so then next I would be assessing her posture, which looks good. She's sitting upright, she looks relaxed. I'm not seeing any obvious physical deformities on her. Her facial expression is nice and calm, it's symmetric. Her speech is fluent. Her mood seems to be calm and relaxed. She doesn't look anxious. She looks to be well groomed and having good hygiene. I'll go ahead and ask though, how often would you say that you shower and bathe?
Daily.
Daily? Okay, good. And what about brush your teeth?
Twice a day.
Twice a day. Alright, perfect, Shelby. Now the next thing I'm going to do is just do a quick skin exam on your arms, so you don't mind roll your sleeves up and just kind of stick your arms out like that for me. And your skin looks good, the skin tone is appropriate for her ethnicity. I'm not seeing any lesions on her skin, and it feels nice and warm and smooth to my touch. And so I'm just going to pinch your hand here real quick. And good. I didn't see any tenting there. She had good turgor, so she appears to be well hydrated. Can you just stick your nails out like that for me? And good. I'm seeing that her nails are nice and smooth and rounded. I'm going to go ahead and pinch one of them here. Sorry. And good. So she has a nice brisk cap refill. That's less than 2 seconds. So she has good perfusion. And then do you just mind if you can just put your hands together like that for me? And it looks good. I'm not seeing any clubbing there, so those are all good findings. Next thing I'm going to do, Shelby, is I'm going to do a couple checks on your eyes here. So the first thing I'm going to have you do is just look directly at me and cover up your right eye. And then tell me when you can see my fingers here come into your field of view, okay?
No.
Okay. Just try to keep looking directly at me.
No.
Okay.
No. No.
Okay, good. So she was able to get all of those. Next thing, Shelby, is if you can just kind of pull down like this. And I'm seeing that her conjunctiva is nice and pink and moist. I'm not seeing irritation there. Her sclera is nice and white. Next thing I'm going to do is I'm going to shine this light in your face. And I'm seeing that her eyes are nice and round. They have an appropriate size and shape. Her irises are blue, an appropriate color. I'm not seeing redness or irritation or swelling around her eyes at all. They look like they're healthy and well taken care of. Shelby, I'm going to shine this in your eyes a few more times here, okay? I need to just see that your pupils are able to constrict properly. And good, so her pupils were able to constrict bilaterally equally on each side. Didn't matter which eye I was shining into. They both constricted at the same time. Now the next thing I'm going to do, Shelby, is I'm going to just have you look back here behind me, and I'm going to shine this in your face. sorry, this is the last time. And I'm seeing that there was the light reflected in the same spot on each eye, which is good. She has a good corneal reflex there. Next thing I'm going to have you do is just follow my finger, okay? Don't move your head, only move your eyes. Good, so she was able to do that. And now I'm going to measure the size of her pupils. Keep your eyes open for me, thank you. And good, so they're about 4 centimeters there, which, or 4 centimeters, which is a normal finding. Now lastly, I'm going to have you look back here behind me, and you can look up at the pen, and look back behind me again, and back up at the pen. Good, so her pupils were able to accommodate. They were dilating when she looked behind me, and when she looked up in front, they constricted. So her pupils are equal, they are round, they're reactive to light, and they're accommodating. Next thing I'm going to do, Shelby, is a couple of tests with your ears here. So first, do you have any trouble hearing ever, or you didn't ever notice any ringing in your ears?
No.
Oh, okay, good. So I'm going to whisper a couple of things and you just tell me what you hear, okay?
Baseball field.
Okay.
Hot dog.
Okay, so she was able to hear what I said, which is good. The next thing I'm going to do is just kind of look at your ears, and they look to be nice and symmetric. I'm not seeing lesions on them anywhere. Do you mind if I go ahead and palpate your ears? Okay, so here I'm just feeling for any kind of tenderness or lumps or swelling, and I'm not feeling anything. Was there any tenderness that you felt? No? Okay, good. So her ears are nice and healthy. Next thing I'm going to do is I'm going to have you make some faces at me, okay, Shelby? So first, if you just do a nice big grin, and then do a frowning face, and then like raise your eyebrows up like you're real surprised, and then just squeeze your eyes real tight for me. Okay, perfect. Thank you. So she was able to follow all my commands there, and her faces were all very nice and symmetric. Next thing I'm going to do is just assess your hair, and I can feel that it's nice and soft. It's not too abnormally dry. I'm not seeing any like splitting here at the ends. Looks healthy and clean. Do you mind if I palpate your scalp?
That's fine.
Okay. And her scalp is also very nice and looks to be clean. I'm not feeling lumps or lesions or anything on there. Looks like she's well taken care of with her hair. Next thing I'm going to be doing is assessing what's called your TMJ,
Okay.
which is this jawbone, right? This area by your jaw right here.
Okay.
So if you don't mind, could you open your mouth for me? And then close your mouth. And clench your teeth. Alright, good. So she was able to do all those things, and I felt the strength was equal on either side, and she didn't have any crepitus while she was doing that, which is good. Next thing we're going to do, Shelby, is I'm just going to palpate your sinuses up here in your forehead. Is there any tenderness there?
No.
And below your eyes, is there any tenderness here?
No.
Okay, good. So there's no tenderness in her sinuses, which is a good finding. Next thing I'm going to do is I'm actually going to have you, well, I'm going to be touching you with a couple of things here, this cotton ball and my pen.
Okay.
And it's not out, so you won't get ink on your face. Anyways, just if you can close your eyes and then tell me whether I touch you with a sharp object or a soft object, and where I touch you, like right or left forehead, cheek, or chin, like that, okay?
Sharp left cheek. Soft right chin. Soft right forehead. Sharp right cheek. Sharp left forehead. Soft left chin.
Okay, good. So she was able to accurately describe all those. So she has a intact trigeminal nerve. Now the next thing I'm going to do, Shelby, is I'm going to have you tilt your head back for me, and I'm going to shine this light up your nose just to check out what we got up there. And good, I can see that her membranes are intact in there. I don't see any dryness or irritation or lesions around her nose. And now if you can just plug one side of your nose and then breathe through the other for me. And then do the same with the other side. Alright, perfect. Thank you. Now next thing I'll be doing here is looking at her lips, and her lips look nice and moist and pink. I'm not seeing dryness or cracking or lesions. And if you can go ahead and open your mouth for me. Go ahead and open nice and wide. And I see that she has all 32 of her teeth, and they were nice and clean. I didn't see any cracking or cavities there, and her buccal mucosa was nice and moist and pink. I didn't see any sores or lesions or signs of thrush there. Her gums were nice and moist and pink as well. They weren't red or inflamed or bleeding, anything like that. So Shelby, the next thing I'm going to have you do is if you can just swallow for me real quick. And good, so her swallow looked nice. And now I'm going to use this tongue depressor, so if you can stick your tongue out at me and say ah.
Ah.
Or can you tilt your head down a little? Sorry.
Ah.
Okay, there. So then we'll see that her uvula was rising midline, and that is what we want. Now the next thing I'm going to do is if you can stick your tongue out at me. And good, so her tongue comes out midline. I didn't see tremors or any sort of sores or lesions on her tongue. So that is good. Now the next thing I'm going to do, Shelby, is I need to feel for your lymph nodes, okay? So I'm going to be kind of palpating around your ears and then down your face a little bit.
Okay.
So we're feeling here for preauricular lymph nodes, and then her postauricular. And then go back down here towards the occipital lymph nodes, and then submandibular. And I'm not feeling any, which is good. If she had an infection or a disease, they might be swollen, and I might be able to feel them, but you didn't feel any tenderness when I was doing that? No? Okay, perfect. Next thing I'm going to do is I'm going to palpate for your carotid pulse, okay?
Okay.
And good, so I was able to feel it on either side. It was bilaterally equal with a strength of 2+. Now Shelby, the next thing I'm going to have you do is you just look up to the ceiling for me, and then look down towards your toes, and then try to touch your ear to your shoulder, and then go to the other side. Perfect, thank you. Now if you can turn your head against my hand. Good, and go to the other side. And shrug your shoulders up against me. Perfect. Alright, so she was able to do all those things, and that's kind of the end of the head and neck cephalic assessment. So from all those, I could, it seems that her cranial nerves are all intact, as she was able to do everything well there. Now I'm going to go ahead and I'm going to palpate your radial pulse here. Good. I'm going to do it on this other hand. Good. So I was able to feel it on either side, and it was bilaterally equal with a strength of 2+. Now Shelby, you can go ahead and squeeze my hands. Good. And then go ahead and push up against me. Okay. And then push down. Perfect. Alright, thank you, Shelby. Now next thing I'm going to have you do is you go ahead and turn this for you, and then take a seat facing that way. And do you mind if I go ahead and look down your shirt here?
Fine.
Okay. I'm just looking to see if she has any lesions or bumps or anything, and looking for symmetry in her back, which she has bilaterally equal symmetry. And her scapula are in the proper place. I'm going to go ahead now and palpate down your spine, feeling for any lumps or tenderness, okay? Let me know if you feel any tender spots, alright? did that feel?
Oh, fine.
Good. Okay. Then I'm just going to go back down her spine, feeling to see if it is straight. And her spine feels nice and straight to me. Now, Shelby, the next thing I'm going to do is I'm going to place my hands down here on your back. And when you feel them, just take a nice big breath in and out for me, okay? And so I was able to feel bilaterally equal expansion there. The next thing I'm going to do is I'm going to palpate here at her costa vertebral angle, or CVA, for her kidneys, and let me know if you feel any pain or tenderness when I do this. And I'm going to be hearing a dull sound. Okay, good. Next thing I'm going to do, Shelby, is I'm going to be actually listening to your respirations, okay? So each time I move my stethoscope, if you can just you could just take a normal breath in and out for me. And good, so all her breath sounds were nice and clear. I didn't feel any adventitious or crackling sounds. And Shelby, you can go ahead and get back in the bed for me. I'm gonna be assessing. I would be assessing her respirations here without telling her, and I'd be looking for them to be somewhere between 12 and 20 rests per minute. Next thing I'm going to do, Shelby, is if you don't mind, I'm just going to kind of lift your shirt here to inspect your chest. And her chest looks nice. I'm not seeing any lesions there. Her skin tone is appropriate. There appeared to be, it's nice and warm to touch and smooth. I'm not seeing any abnormalities. I'm going to go ahead, is it okay if I palpate your chest? I'm going to be feeling for lumps or tenderness, and you just let me know if you feel any discomforting where that I'm touching, okay? Any tenderness down there? No? Okay. Alright, good. Next thing I'm going to do is I am going to just go ahead and listen to your lung sounds here in the front again, like we did. Same thing on the back, just each time I move my stethoscope, if you could just take a normal breath for me.
Okay.
If you don't mind lifting up for me. Good, so I was able to hear that her breath sounds were normal. I didn't hear any adventitious sounds or crackling. Now the next thing I would do is I would ask her actually to just lean forward for me, and I'm going to be listening for any heart murmurs. I'm going to be listening for these at the base of her heart up here. And good, so no murmurs there. Now next thing I'm going to be doing is I'll be palpating for her apical pulse, which is going to be at the midclavicular line on her left side at the 5th intercostal space. You might need to lift up for me again. And good, so I can feel her apical pulse right there. Now, Shelby, the next thing I'm going to do is I am going to listen to your apical pulse with my bell. Thank you. And good. So sounds good there. Now I'm going to go back through and auscultate each of the 5 spots with both my diaphragm and go back through and do it with my bell. Have you lift it up for me again? Good. And go back and do it with my bell now. Have you lift up again? Good, so I heard all normal heart sounds there. And now with my bell, I'm also going to have her lean to her left and listen to her heart sound one more time. Hear her apical pulse. And good, so I was having I heard normal sounds there on that. And Shelby, the next thing I'm going to have you do is, if you don't mind leaning back for me, and you can just lay back on the bed. And if you don't mind pulling your shirt up, and I'm just going to, hey, I'm working on something.
I know you are.
Mom,
Blake
I
and I are
got it.
waiting. Okay, hurry up.
I apologize for that. Okay, so Shelby, okay, so I'm going to be inspecting her abdomen here, and I see that she has dry, intact skin. It's warm to touch. I'm not seeing any pulsating masses. So the first thing I would do, since I already have my bell set up on my stethoscope here, is I'm going to auscultate her aorta and be listening for any bruise. And I hear normal sounds there. I don't hear any bruise, and I'm going to switch to my diaphragm, and I'm going to auscultate her bowel sounds. I'm going to start in the right lower quadrant and work clockwise. And good, so I'm hearing that she has all normal bowel sounds there. The next thing I'm going to do, Shelby, is I'm just going to be percussing around your abdomen, and I'm going to be hearing resonant sounds when I do this, and I'll likely hear a little bit of dullness in the right upper quadrant because that's where her liver is. And good. Okay, so the next thing, Shelby, is I'm going to be palpating. Okay, I'm going to go around and just do some light palpitations first. And then afterwards, I'm going to go around and go a little bit deeper. Please let me know if you feel any pain or tenderness. I'm just feeling for any lumps or masses. I'm going to go a little bit deeper now this time, okay? And good, so everything feels normal there. I didn't feel any lumps or masses. And Shelby, you can go ahead now and sit up for me. And now I'm going to first, here, probably, I'll just have you hold this again, just so we can see what we're doing with our feet down here. Here, I'll angle it a little more down so you can see your feet there. That's good. Okay. All right, so I'm going to be assessing her feet here, and I'm seeing that, I might need you to, sorry, just pull these up a little. I'm seeing that her skin is, again, it's warm, dry, it's intact. I'm not seeing any lesions. I'm not seeing any varicose veins. And I'm going to go ahead and I'm going to palpate for your dorsalis pedis pulse here. And I feel that the pulse is bilaterally equal on either side with a strength of 2+. And I'm also going to palpate for your posterior tibial pulse. And again, I'm feeling that it's equal on both sides. It is bilaterally equal, has a strength of 2+. And the next thing I'm going to do is I'm just going to be feeling her feet here, and they're nice and warm. And I'm not really seeing anything besides just possibly a small amount of trace edema. And Shelby, the last thing I'm going to have you do is you just use your feet and push against my hands here. Good. And then just pull back against them. Perfect. All right, thank you, Shelby. And then I'll be giving you your call light here. There's that. And then is there anything else I can grab for you before I leave? You're doing well?
Yep.
Okay. I'm going to go ahead and take my gloves off, and I'm going to foam out here. And I'm going to go ahead and leave, and I'll pull your curtain and make sure your door is shut for your privacy, and I'll be back to check on you in about an hour, okay?
Okay.
Sound good?
Yep.
Thank you. All right, you can stop it.